Hi everyone, my name is Dr. Mark Algee, and I thought I would take a quick moment to communicate who I am and what it is we do. My grandmother was a medical doctor, and in her day she opened a little hospital, and she saw 1,500 women who delivered babies in her hospital. It still stands in Compton, California. My grandmother was an inspiration to me, and her medical knowledge was very impressive. In her footsteps, I had made a decision years later to go off to Southern California University of Health Sciences down in Whittier, California. The body has always fascinated me, the way it works, the way it moves, how its muscles and joints hinge together, the fluidity of movement in patients, and how people injure themselves. In my practice, we don't simply focus on pain. That's why most patients come to us. But once patients are in our doors, they find out we do a whole host of things outside of just pain care. And for patients who want to have their pain reduced, we can do that. Patients also find out that they've had undiagnosed head injuries, that they have balance issues, they have muscle injuries, and we try to bring patients back to the level of health that they desire. That's what we do here in the office. So I'm going to put this video together. I'm going to show you some of the things that I've done in my life, from testing patients with balance issues, testing their muscles, making adjustments, doing massage, and demonstrating the wide range of things that we do here. With this patient, what I'd like you to notice is how unstable she is before treatment. Look at how her arms are out. Look at how she doesn't have a center of gravity. And then look at after treatment. Balance is a representation of brain function. It's also a representation of muscles and joints that are not working or articulating properly. This is a little workshop I did here in the office, and we're using Gary to demonstrate balance. So once again, this is before. This is a right foot forward in a right foot forward test, and we can see his balance is not steady. Remember, balance is an indication of brain performance, both the inputs and outputs from the body to the brain and from the brain to the body. Here we have him do a heel to toe test, and this test is the sobriety test we see on TV. And you can notice how his stability is very poor with his eyes open, by the way. After the test, I have Gary do the cerebellar exercise with him. This is to stimulate an area of his brain that deals with balance. The same test that Gary could not pass the last time, he passes easily now.
That's huge. Good job.
Sobriety test.
Here we redo the sobriety test, and we can see that Gary gets off to a shaky start, but after that his balance stabilizes and he's much more certain. Gary texted me later stating that he could do a one-legged stand, which he hasn't been able to do for some time.
This is a video I uploaded to YouTube some time ago, and you can watch it elsewhere. I'm going to speed it up, but I want to demonstrate that with each patient examination we check muscles, reflexes, and what we're looking for is muscular injuries and patterns of normalcy. If we don't find patterns of normalcy, we look to find out where something's out. When a muscle is injured or doesn't work properly, what happens is that muscle doesn't support the joint. And if it doesn't support a joint, this is what causes joint pain. It also causes a loss of coordination and lack of an ability to move properly. And the patient's fluidity of movement is decreased. In this patient's case, what I want to demonstrate is how the tuning fork is used in treatment. And what we use the tuning fork is to measure how the brain perceives sensation. What you'll notice when I take the tuning fork and touch this young man's right foot, I want you to look at his facial expressions. He's extremely sensitive. This is abnormal. I'm shorting this video. You can watch it elsewhere on YouTube. After treatment, he's no longer sensitive to the tuning fork. That is normal. And you won't find that most chiropractic offices use a tuning fork in treatment.
Much better. How's that, Logan?
This is me in my youth learning massage at the Body Therapy Institute in Santa Barbara, California. And this is me a decade or two later teaching massage in Ghana, Africa. And it's interesting to watch the cycle of life continue from one generation to the next and to be a part of that continuation of teaching. I kept my skills. They got better as the years went on. I'm not certain why I couldn't keep my young body. This is a picture of me in the Marine Corps sleeping under a 5-ton truck. If you notice, my pillow looks like a flak jacket. This is for those patients who ask me, have you ever slept in an awkward position, Doc? Yeah. And lastly, in closing this video series, on the right, that's me jogging in probably 1998, 1999's Los Angeles Marathon. And on the left is me doing the color run here in Ventura, California. So just to demonstrate, I have been an athlete in my life, and I understand when an individual has injuries, how they impede your performance and your athletic ability just to simply work out.